When I came to Duke, I looked at the graduates and even the second and third years at the time, and I saw the type of doctors that they were describing themselves being and how confident and just extraordinary they were. And I thought to myself, well, if I could do that instead of just being competent, that's what I'd like to do.
Our emergency physicians at Duke are inquisitive. They're taught to challenge ideas and boldly go where no one has gone before. I know it sounds a little crazy, but the metaphor of choosing the moon or going on a mission to a place where humans haven't ventured in medicine before is really physical and real for us. It drives us to come up with new research questions, new practices of emergency medicine, and to incorporate the best evidence for our patients' care. We're not satisfied with doing emergency medicine the way it's done today, but seek ever to push that horizon forward into the future.
Coming to Duke, you expect a lot of big things to be happening, and that's just across the board. Everyone's doing great things, and to be involved with all of them in some aspect has been awesome for my education personally and for my experience overall.
Procedures, transvenous pacers, chest tubes, intubating, central lines, and pretty much have the patient all wrapped up by the time they need it, those patients that need to come in, which from a learning point is unbelievable.
I think our patient population at Duke is very special. There are a lot of people that move to the area just to get care at Duke, so they're very medically complex. So we take care of folks with organ transplants and LVADs, and it's kind of a regular thing for us.
I think we have really a tremendous group of residents here. They are the residents that I would hope to work with. For them, medicine isn't just about doing the job, it's truly about having a passion.
No matter what I did, I wanted to make an impact on people. We definitely get to do that with our line of work. When patients come into the emergency department, it's a lot of times the scariest moment of their life. And you get to give them care, comfort, reassurance. The attendings, the residents, the nursing staff, we all get to do that. And it's a pretty dark period for them, and so to be a light, it definitely gives you the impression that you're leaving a profound impact on them.
I went to residency with some of the most intelligent people that I've ever met in my life, also some of the most compassionate people.
I don't know why the match works out the way it does, but it does, and the 10 other people in my residency class, we really just clicked from the beginning.
I was surprised by the level of camaraderie here. People don't put a lot of pressure on you to do things. They just want to support you. There's not a lot that seems like you're being kind of evaluated, but more like you're being supported and that people are genuinely interested in making you kind of the best emergency physician that you can be.
We're people who smile a lot. We know our work is serious, but we also find the humor and the joy in being together and caring for patients.
When you come here, you will be an exceptional physician. We'll teach you compassion, teach you how to deal with and take care of the most complicated patients that there are. But we're also creating leaders in our field, and I think that's the important part. We want to change the face of emergency medicine.
I wanted to be the best doctor I can be, and this is a place that offers me the resources to do that, but also the type of people that inspire me and are openly there to collaborate with. And so I just think the combination of what this place stands for and the type of people that are here, it's just a very special place to be part of.
We don't go to space by waking up one morning and saying, it's 8 o'clock, let's hit the heavens. Instead, you train for years, like the astronauts do, to prepare for that moment when your skills will be needed in a crisis. And we train in the same way for our patients in that moment of health crisis for them. Our residents do it, our faculty do it, not just to maintain excellent clinical skills, but to become better educators.
I think one of the most special moments during my residency was when I officially realized I was a doctor, and I walked into the room of a really sick patient with my attending, and my attending waited for me to make a decision. And I faltered, and I was unsure, and I was really scared, but she was right there. And together we were able to to help this patient, and it really made me realize how far I've come, how far I still have to go, and how Duke was going to get me there.